What's up, respiratory world? This is what we call a nasal trumpet, nasal pharyngeal airway. We usually measure it from the tip of the mandible to the patient's earlobe, tip of the patient's earlobe, to make sure it's correct patient size. You see the opening. When I have somewhat measured along the patient's airway, you can probably gauge the patient have big nares, smaller nares, but this is to facilitate frequent suction. Sometimes our patients are unable to clear their secretions on their own, and we have to give them nasotracheal suctioning. We go through the nares into the trachea that goes into the down towards the lungs, into the trachea to suction a patient who needs frequent suctioning. So I'm about to place one of these nasal pharyngeal airways inside of a patient because he needs frequent suctioning. And in order to frequent suctioning, we have to go down with a 14 French catheter. So this just makes it a little bit easier to go into the patient's airways without causing a lot of trauma. It bypasses, gets through the nares into the trachea and starts to get down into the airway, so we can suction them a little bit more frequently without causing too much trauma, too much bleeding. So I'm going to place one of these nasopharyngeal airways